Hi everyone, I'm Dr. Sai Shruti. I'm Head of Microbiology and Infection Control at Sankara Eye Foundation, India. So let us learn about hand hygiene. Hand hygiene is a way of cleaning your hands that will substantially reduce potential pathogens. Now, what are pathogens? Pathogens are disease-causing microorganisms, that is viruses, bacteria, fungi, parasites, which can lead to occurrence of diseases in human beings or animals are called pathogens. So, hand hygiene is considered a primary measure for reducing the risk of transmission of infection amongst patients and amongst healthcare personnel. We all know that it is the single most important means to prevent the spread of infection. According to Sir William Osler, soap, water and common sense are the best antiseptics. So we all need to learn how to clean our hands in the best way so that we can stop transmission of infections. Now let us understand why hand hygiene is important. As I told you earlier as well, it is the most common mode of transmission of pathogens. So in case we want to reduce healthcare acquired infections, we need to perform hand hygiene properly. Also, our hospitals are home to a lot of disease causing bugs or infections. We have patients walking in, we have healthcare workers who are dealing with patients in the OPD, in the theatre. So a lot of transmission happens. Also, the bugs or the microorganisms that are there in the hospital environment are really resistant. That is, they are resistant to a lot of antibiotics. So in order to prevent this antimicrobial resistance, we need to perform proper hand hygiene. And it is said that 80% of infectious diseases are transmitted by touch. So we all need to see how to perform hand hygiene and to learn it properly to reduce infections. Now, what are the hand hygiene procedures? So there are three procedures: hand rub, hand wash, and third is asepsis or surgical hand hygiene. So let us see what are the steps involved in hand wash or hand hygiene. First is palm to palm, then it is palm to back, both the hands, then interlacing, interlocking, both hands, thumb rolling and nails. Okay, so these 6 steps we use for hand rub and hand wash, and surgical asepsis or antisepsis is a separate procedure altogether. So let us know how to perform each one of these in detail. First is alcohol based hand rub. So this is rubbing your hands clean with an alcohol containing preparation like your sanitizers which we use during COVID or your hospital based hand rub solutions. So first we take recommended amount of products, that is 5 to 10 ml of antiseptic hand rub alcohol based solution on your hands. You apply the product to the palm of one hand and you rub hands together, making sure all the surface are in contact with the solution so that there is cleaning of hands completely. And if you follow the 6 steps properly, then the hand rub solution gets spread to your complete hand and we get clean hands at the end of 20 to 30 seconds. Now, how will you understand that you have done adequate hand rub? So, if you have taken 5 to 10 ml of solution, at the end of 20 to 30 seconds, the solution should dry in your hands completely. It means effective hand rub. Second is hand washing. So what is hand washing? When we use water and soap and other antiseptic containing detergents to clean hands, it is hand washing. So first we wet our hands with water. Remember, do not use really hot water. It can cause dermatitis, irritation or even burns. Then we apply soap to hands and then rub the hands palm to palm for 15 seconds, and then the next step, palm to back, interlace, interlock, thumb rolling and nails like we did in hand rub for 40 to 60 seconds, and then we rinse our hands with water. And remember, we have to dry our hands only using paper towel or ambient air. Do not use linen or cloth based hand dryers. For hand washing, the procedure has to continue for how long? For 40 to 60 seconds. The same steps that you did for hand rub, except for here you use soap and water. Then is antisepsis or surgical hand hygiene, where 3 to 5 minutes initially you perform cleaning with soap and water, and then subsequently with the iodine based antiseptic solution. So this type of hand hygiene is done by surgical professionals or those who are going to go inside the operating room. Now let us learn how to perform hand rub and hand wash watching a demonstration. First, let us see the steps involved in hand rub. So first we take recommended amount of products, that is 5 to 10 ml of antiseptic hand rub alcohol based solution on your hands, palm to palm, then it is palm to back, both the hands, then interlacing, interlocking, both hands, thumb rolling, both hands, and nails, both hands. Okay, so these 6 steps we use for hand rub. I hope you all understood. These are the steps involved in hand rub. Now let us see the steps involved in hand washing. So what is hand washing? When we use water and soap, so first we wet our hands with water, then we apply soap to hands, palm to palm, then it is palm to back, both the hands, then interlacing, interlocking, both hands, thumb rolling, both hands, and nails, both hands. Okay, so these 6 steps we use and hand wash for 40 to 60 seconds, and then we rinse our hands with water. And remember, we have to dry our hands only using paper towel or ambient air. I hope you all understood how to perform hand wash. So now we have to understand the difference between hand rub and hand wash. The difference is the indication for which we are doing rub or wash. Routinely, we perform hand rub when our hands are not visibly soiled, they are not dirty. I'll come to the typical indications of hand hygiene that is given by WHO in the next slide. But when your hands are not visibly dirty and routinely during patient care, you can perform hand rub because it is a shorter procedure, takes less time. But when your hands are visibly soiled, you are dealing with a patient with diarrhea before and after eating food, before and after using the washroom, we do hand washing. Especially when your hands are visibly soiled. What is visibly soiled? When you can see blood and body fluids on your hands with naked eyes, we perform hand washing with soap and water. Otherwise, for routine patient care, you can do hand rub. I hope you understood the difference between hand rub and hand wash. Now we will see the 5 moments of hand hygiene. So what is this 5 moments of hand hygiene? Let us understand this as WHO has explained to us, that when do we need to perform hand hygiene in a particular order. So first is before patient contact, that is before touching the patient. So you clean your hands before you touch a patient or you are approaching the patient. Why is this moment important? This is to prevent infection from you going to the patient. For example, you're going to perform ECG, you are going to take the BP of the patient. So all these are what moments you're shaking hands with the patient is also touching the patient. Then before an antiseptic task, for example, you're going to insert a Foley's catheter or you're going to put a Venflon in the patient. All these are what? Antiseptic or aseptic procedures where you don't want to insert any microorganisms from the hospital or your hands inside the patient's body or mucosa. That is called a aseptic task. Before that also you have to perform a hand hygiene procedure. After body fluid exposure, or for example, you have got contact with the patient's blood or body mucosa. After that, to prevent yourself from getting the infection or transmitting it to the next patient, you have to perform hand hygiene. Okay, so after body fluid exposure risk, in that case you have to perform hand hygiene. Fourth is after touching the patient. So after touching the patient is so that you do not get any infection from the patient or you don't transmit the infection to the next patient, you perform hand hygiene. After taking BP, after moving the patient, after shaking hands, all these moments whenever you are doing so, you have to perform hand hygiene. And the last is after contact with patient's surroundings. For example, you have adjusted the patient's Venflon rate or the fluid rate, or you have adjusted the bed rail of the patient. All these are patient surroundings, the patient's household contacts, or the patient might have touched these ambient surfaces, and whenever you touch these, after this you have to perform hand hygiene. So we will just repeat the 5 moments: before touching the patient, before an aseptic task, after exposure to body fluid or after performing a procedure, fourth is after touching the patient, and fifth is after touching the patient's surroundings. So we all need to remember these 5 moments of hand hygiene. Okay, so that's all about hand hygiene. So we need to remember is what are the 3 types of hand hygiene: hand rub, hand wash, and surgical procedure. We need to understand that there are 6 steps. So you have to perform hand hygiene following all the 6 steps of hand hygiene, either wash or rub. When do you need to do hand washing? When your hands are dirty and visibly soiled. And the 5 moments of hand hygiene: before and after touching the patient, before and after a procedure, and after touching patient's surroundings. So in case you have any doubts, please contact your infection control nurse. Thank you.